Hey, Maxicare members, welcome to Maxi Life Wellness Fridays featuring dealing with TB during the pandemic. I'm sure you guys are very aware that it has been difficult in so many levels, but I'm glad that you all are here because this is another Maxicare offering for you so you can all live your best lives because that's exactly what Maxicare wants. And they want to make sure that you are well informed about diseases such as tuberculosis. I'm Patricia Bermudez Hizon, and I'm honored to be your host for today and to be learning alongside you. As per the Department of Health's calendar, August 19, which is yesterday, was actually National TB Day. So this is fitting to talk about this topic today. I want you guys to watch this video.
Sa gitna ng COVID-19 pandemic, kailangang matibay ang ating dibdib laban din sa mga sakit tulad ng tuberculosis o TB. Magpa-check up at alamin kung may TB ka o wala. Magpa-chest x-ray at magpa-test. Magpagamot. Magpakasigurong wala ring TB lahat ng mga mahal mo. Maging matatag. Proteksyonan ang sarili at makipag-ugnayan sa iyong health center o TB clinic. Isang paalala mula sa #TBFreePH ng Department of Health at USAID.
Well, it looks like we all are ready to go. Thank you so much for sharing with us your insights. So let's officially kick off our MaxiCare Wellness Fridays. Welcome to Maxi Life Wellness Fridays featuring dealing with TB during the pandemic. Again, I'm Patricia Bermudez Hizon. I'll be your host for this session. The COVID 19 pandemic has greatly impacted the delivery of TB services. There may be delays in the diagnosis of TB as well as treatment initiations because of the stigma around COVID 19 and the interruption of TB services. Patients with TB should continue and complete their treatment, get prioritized for COVID 19 vaccination, and continue to observe minimum health standards. This is why we have a wonderful speaker who will share with us her knowledge on tuberculosis today. Our speaker is a fellow at the Philippine College of Chest Physicians, the American College of Chest Physicians, and Philippine College of Physicians. She is also an associate clinical professor at the Manila Central University College of Medicine. Her extensive background will be very valuable to us today as we understand TB during this pandemic. Let us all welcome Dr. Lalaine Mortera. Good afternoon, Dr. Lalaine.
Yeah, good afternoon. And thank you, Pat, for the very kind introduction. Can you hear me well?
Yes, I can, Doc.
Okay, I will try to share my slides.
Go ahead. As you try to share your slides, again, I want to thank everyone for sharing their insights and also their names and company names also on our chat. Now, going back to the presentation of Dr. Lane, we're all looking forward to this as we understand how to deal with TB during the pandemic. Go ahead, Dr. Lane.
Okay, thank you, Pat. So I'm glad that you chose this topic for this Friday wellness. And yeah, this month is long month. And then dealing with TB during the pandemic is really something that is very challenging. So I would like to always start my talk with my disclosure. I don't have conflict of interest for this particular topic. Okay, let's start with the topic on hand. Based on the 2016 Philippine TB prevalence survey, around 1% Filipinos have active TB, and many may not even know that they have it. And I think some of the audience here may not know that they have TB, but I'm glad that 98% actually are undergoing their annual physical exam. Now, based on the WHO report in 2020, this is actually based on the 2019 data, where in the Philippines there are already about 554 cases per 100,000. And in terms of mortality due to TB, that's 27,000. But if we will translate that to actually a rate that is more relatable, so if we divide 27,000 by 365 days divided by 24 hours, we actually get a number of 3 deaths Filipino dying of TB every hour. And that's something that is really very dismal. In fact, it makes TB as the deadliest infectious killer not only in the Philippines but in the world. Now, if we talk about TB, it actually affects the most productive age group. Now, based on the National Prevalence Survey, as you can see here, the age group that is most affected are belonging to ages 15 to as old as 64 years old. And if we look at this, they are also predominantly affecting the males. Now, if we look at the workplaces that actually are affecting our most productive age group, Filipinos, there are certain environmental factors that would also affect the likelihood of a patient to develop TB, like congregate setting. If you work in an enclosed, cramped, poorly ventilated area, like our miners, and if you are exposed to persons with untreated TB, I would like to emphasize it's untreated TB because if you have completely treated your TB, then definitely you are not infectious. And also, we have to look at host factors like the elderly having the higher risk to develop TB. Being male is also a risk factor, more so if you are a male smoker. History of TB. So, prior history doesn't prevent us from having TB again. Diabetes, HIV, poverty, and of course, poor nutrition. Now, this survey actually also gives us insights to how Filipinos behave in terms of their health seeking behavior whenever they have TB symptoms. And the TB symptoms used in the survey is 2 weeks cough or coughing out blood. And this is done among patients who already have confirmed TB. Unfortunately, 41% will not do anything. I think some of us are guilty about this. If we do have cough, we tend to just dismiss it and not do anything. And that's probably the reason why TB is still prevalent nowadays because 40% are not doing anything. Now, 40% would self medicate. So people would go to the drugstore, probably buy their favorite cough preparation like Darlagundi or carbocysteine or whatever cough preparation that they can buy from the drugstore. And sad to say, they actually delay appropriate treatment and consultation. Only 19% actually seek care. And based on this survey, 67% would prefer to go to the public sector. Now, what were the reasons for not consulting, even for among patients who had TB symptoms? This would actually give us a eye opener among patients and the behaviors that would tend to for them to delay seeking care early. The number one reason is people think that the symptoms they have, 2 weeks cough, and even coughing out blood is not significant. So they tend to downplay it and then postpone the appropriate consultation with the medical professional. They also would make access to as and cost as the reason. So they find that going to the doctor might be expensive and they tend to postpone. And then third is time. They're busy. They don't have time. They are busy at work. And they tend that this can be postponed and later when it gets worse than the time they will consult the doctor. So if you also notice in this survey, males are observed to be more, they tend to downplay symptoms and value cost and time compared to the female counterparts. Now, this is a short study based on a 2019 survey among behavioral barriers for health-seeking behavior. Patients with TB think that, like in the prevalence survey, cough is not severe, that the risk to having TB is not in them. They think that it's only associated with being poor and with those with vices. So if they're not poor, then the likelihood that they'll have TB is very low. They also think that there is the stigma and then the discrimination. They're afraid that if TB is confirmed, they will be avoided by their coworkers. And these are the realities that people would really tend to face and delay further appropriate care. Now, how do we know that we have TB? One of the major advice that we give our patients is to look for the cardinal signs and symptoms for TB. And we always use 2 weeks cough, 2 weeks fever, 2 weeks unexplained weight loss, and sweats. Unfortunately, if we use this symptom screen, only one third will get detected by using symptom screen alone. Meaning, if we don't have the symptoms, we can potentially miss two-thirds. So we would like to prefer a more objective and more sensitive test. And an example is your chest X-ray. So if you have a chest X-ray that is suggestive of pulmonary tuberculosis, regardless whether you still don't have the 2 weeks cough or you don't have symptoms, then I think this is a way to say that you may be a presumptive TB based on the findings on your chest X-ray. And based on the prevalence survey, 98% of those bacteriologically confirmed had abnormal X-rays. So I applaud those who actually answered 98%, who underwent their annual physical exam. That's a way of our surveillance to see whether we have TB or not. And also the challenge of the low risk perception. Patients would tend to say that although they have the symptoms or they have the x-rays already suggestive of TB, the likelihood that TB is not is actually what they have is they think it's unlikely, and they tend to postpone or delay appropriate care. So that's the reason why when patients go to health facilities, we are encouraging a form of systematic TB screening. And that is what we call intensified case finding. And this is already what is recommended by Department of Health National TB Program. So first is patients are actually asked or evaluated for the cardinal signs and symptoms for TB. So any of 2 weeks cough, unexplained fever, unexplained weight loss, and night sweats. And any of this one would make a patient to be a presumptive TB. And being a presumptive TB, then therefore we have to collect sputum immediately. The second approach is when you don't have these cardinal signs and symptoms. Perhaps you have only less than 2 weeks cough. You're starting to have a fever of 1 day or 2 days duration. That's when we request for a chest X-ray. And perhaps if it is suggestive of TB, then we are labeled as presumptive TB, and therefore we need to already collect sputum. A third scenario is during the workplace and in congregate settings where we actually recommend an annual chest X-ray, so that if you do avail of this annual physical exam and an X-ray is included, if findings are suggestive of TB, then therefore we have to already collect sputum to confirm TB. But if it is not suggestive, then we just the evaluation ends. Now, the fourth one is for health workers. And I believe 51% of the audiences are belonging to or are working in healthcare facilities. So what's the recommendation for healthcare workers? We should have a baseline screening and X-ray upon entry, and of course the TB symptom screen, and every year thereafter. And in between, we should have a symptom screen or a scalp surveillance between our baseline and our annual X-ray, so that if we have chronic cough, we have any of the 2 weeks cardinal signs and symptoms, then definitely we have to submit our specimen. Now, particular precautions or recommendations for persons with HIV is to do both symptom screen and X-ray immediately once they are diagnosed to have HIV and every time they visit the doctor. So it is a more proactive, more aggressive way of surveillance for our patients with HIV. And of course, for our household contacts, regardless of age, they should undergo some contact investigation, especially if there is a member of the household who has been recently been diagnosed to have TB. Now, during the pandemic, though, the TB care has actually changed a lot. In fact, if you look at the COVID response, TB has taken a backseat. most laboratories have been repurposed to do some COVID testing, and some testing for TB actually were rescheduled into once a week only or twice a week from the previous daily testing. So with the COVID-19 pandemic, TB care has been challenged, and we see a lot of disruptions. Healthcare facilities have actually closed or are optimally operating, so they have minimal operating hours. Some have opened, but they have opened more for COVID services. So in terms of COVID, we look at this data. There already are 209 million confirmed cases with COVID, and already 4 million dying of COVID. And because of this data, it has actually surpassed or overtaken TB as the highest infectious killer in the world. Now, there was a survey done, and this is more of a modeling analysis done by Stop TB Partnership, looking at the potential impact of the COVID-19 response on TB, especially in high burden countries like the Philippines. And if you look at this graph, the Philippines is actually included here, where we see a downward trend, especially for immediately after the lockdown last year, April. So you see a decline, market decline in the notification for TB in April, and that was a month after declaration of ECQ in the in Metro Manila. And this is the similar trend for India, Indonesia, and South Africa. So this modeling analysis, this is actually very scary, because they predicted, based on this modeling analysis, that globally, if we have a 3-month lockdown, and there is a protracted 10-month restoration, this could lead to additional 6.3 million TB cases and additional 1.4 million TB deaths in the next 5 years. And this is a setback of about 5 to 8 years in terms of the accomplishments that we have in terms of TB control, only due to the COVID-19 pandemic. And unfortunately, more dismal, they have predicted additional 100,000 Filipinos dying of TB in the next 5 years if we do not resume TB services before the COVID pandemic. Now, you see here the three high burden country lists. The WHO lists the top three countries for tuberculosis, for multi-drug resistant TB, and for TB and HIV. Unfortunately, we belong to the top 30 for TB and multi-drug resistant TB, and not yet, fortunately, for TB and HIV. But with the COVID pandemic, there are already around 180 or more, 180 countries affected by COVID-19. And especially with the Delta variant, we already have the Delta variant being reported by more than 100 countries, where it is 50% more contagious. The risk is higher, and the complications and the risk of hospitalization higher among those unvaccinated. It spreads more quickly, and it affects the younger population more often. So this is the challenges that we have to deal with the TB care. So we have a twin pandemic, the TB burden as well as the COVID pandemic. Now, the Department of Health actually came up with this manual of procedures that I will be sharing the highlights later on. But these were not situated in the context of the COVID pandemic. But for the health workers who are in the audience, then you can always look at these references. And I have placed here the link to these references. This is a quick guide a packet guide for the guidelines on how we care for TB. Now, recently, last year, the Department of Health actually came up with a National TB Control Program Adaptive Plan, where it detailed some procedures on how TB care can be resumed safely, even during the pandemic. Now, if you look at COVID-19 and TB, there are many similarities and differences. For if you talk about COVID-19, we talk about acute symptoms, a day or less than 14 days of the onset of your symptoms. But for TB, it's 2 weeks or more. But we see patients with TB who may present with less than 2 weeks. And we also see some overlapping presentation and risk factors that may be challenging for the doctors to delineate whether a patient would have COVID-19 or TB or both. So we also, for example, for COVID-19, we actually, these are the common symptoms: colds, sore throat, loss of smell, fever, cough, difficulty of breathing. But if you talk about TB, there is an overlap of your symptoms. TB also presents with fever and cough, and weight loss and night sweats. And these are actually the cardinal four symptoms that I've mentioned earlier. Now, difficulty of breathing comes acutely for COVID-19, but this is a delayed or a symptom that happens way after or long after for TB. So the onset of difficulty of breathing in TB comes later on. So it will come in perhaps months or years later. Now, also for the risk factors, there's an overlap. For both COVID-19 and TB, we talk about diabetes, smoking, previous TB, being elderly, and having HIV as a common risk factors for both diseases. And that makes sense for us to really screen for both COVID-19 and TB whenever patients present with respiratory symptoms. So across the continuum of care, when we talk about screening, it is very helpful to say that we have to have early detection through systematic screening to prevent further transmission of TB. The earlier we detect patients to have TB, the better to be able to arrest or to put a pause in the further transmission of the infection. Again, I would like to emphasize that if we use symptom screen alone, we will be only detecting a third. But if we do X-ray as a screening tool, then we'll be able to have a higher yield and be able to discover the patients who may have TB even without the 2 week scan. Triage and segregation is very important, especially during the pandemic. We don't want people to be mixing patients with respiratory symptoms with those without respiratory symptoms. So let us observe and be wary of facilities who really observe this triaging and segregation. The use of face mask, shield, and physical distancing whenever we consult are very important. And I think during the COVID pandemic, the use of consultation is actually very helpful. Now, when we talk about systematic screening based on the WHO, it actually is defined as looking for patients with TB actively in a predetermined target group. And the test that should be done or will be used can be applied rapidly. Now, we may prioritize TB screening depending on the local epidemiology and resources, like persons who are in congregate setting, persons with untreated fibrotic chest X-ray lesions, patients who are in care, who are already have the risk factors that I've mentioned earlier, or are healthcare workers in countries that are belonging to high TB prevalence countries, then TB screening should be done and prioritized. Now, we also recommend that TB screening should be done in all settings for the following groups: all contacts of persons with TB. The number needed to screen is 17, meaning you need to screen 17 to identify one TB case. Persons living with HIV, the NNS is only 10, so they should all be routinely screened for TB. And workers in silica exposed workplaces, the NNS is 36. Now, this is actually the typical patient-initiated pathway where a TB patient would potentially delay consultation because of knowledge barriers or access issues, or what I mentioned earlier, they tend to delay because of low risk perception. And when we do some systematic form of screening, we actually reduce the turnaround time between a patient consulting and being diagnosed and offered this quality diagnostic test. Especially now with COVID, because patients may present with the same symptoms. And the key here is to have an effective triage to be able to identify who among patients should be able to be seen earlier and be able to diagnose earlier to favor early detection. So how exactly do we do systematic TB screening during the pandemic? I think you are all familiar with this. We all are filling this up whenever we go to any facility. We're asked of COVID symptoms. But I would be suggesting, especially in the workplace, why not include also symptoms for TB, just for additional questions. 2 weeks cough, unexplained weight loss, fever, and night sweats. And we'll be able to identify potential presumptive TB. And I would like also to share with you this online TB self-assessment tool, which you can access in the www.tbfreeph, because sa TB, hindi pwede ang hula-hula lang. So in this TB self-assessment tool, the patient is guided as to which symptoms they can have and what are the diagnostic tests that can already do. So would an X-ray be more appropriate, or would they be definitely be proceeding to already a confirmatory sputum test? So this is how we recommend the algorithm whenever we have patients during the COVID-19 pandemic. First level of screening before going to the facility, already do your teleconsultation. So you'll be triaged well and be able to fill up this screening form. For the second level of screening, when you are in the health facility and you are faced by the triage personnel, definitely face mask, face shield, and thermal scanning should be done. Hopefully, we are encouraging that we both screen for COVID-19 and TB, so that we'll be able to know who among the patients are COVID suspect only, COVID suspect and presumptive TB only, and none. They don't have COVID symptoms, and they don't have the symptoms for TB. And this is the lesson that we learned in the COVID-19 pandemic. We used to just have all these patients wait in a general common patient waiting area. But we know, because of the COVID-19 pandemic, we have to isolate, we have to segregate, and we have to request patients to be staying in an area if they have symptoms, and patients without symptoms to be staying in a general patient waiting area. And for those who reach the doctor's clinic, that the doctors be able to offer X-ray every time patients who, even if they're not consulting for respiratory symptoms, to always offer chest X-ray, especially if the previous X-ray was more than a year ago. Now, probably will ask me, what's the value of chest X-ray as a screening tool for TB, even if you don't have symptoms and if you don't have any risk factors? Based on the clinical practice guidelines that was released last year, even without risk factors, although there is no evidence demonstrating the accuracy of X-ray, but based on the prevalence survey that we have in the Philippines, which showed that 10% of those that have bacteriologically confirmed TB did not have risk factors and did not have symptoms for TB, but they had TB. So I think it is prudent to have an X-ray, at least to know whether our patients would go to the next level, which is the confirmatory TB test. Now, this is the typical environment that we have. At home, there are what we define as a close contact. Anyone that is sleeping, eating, working with a recently diagnosed active TB case at least 4 hours a day for 3 to 4 consecutive months. However, for COVID-19, it's a different story. It is more acute. More than 15 minutes, the distance less than 1 meter, and there's no use of PPE, then there is already a close contact, and therefore we need to do some contact tracing. So the value of contact tracing is true for both TB and the COVID-19. And why do we need to do this? I think you have heard this on TV when they talk about R naught. R naught is a number that actually refers to the number of patients or persons that a patient that has TB or COVID-19 would actually infect. For TB, the R naught is about for high risk countries can be as high as 4.3, but it can be as low as -1 or less than 1. But for SARS-CoV-2, the R naught is 2.2. But with the Delta variant, it can go as high as 4. So the difference between TB and SARS-CoV-2, for TB bacilli definitely is airborne. And it's afloat in the air for up to 6 hours. And it gets diluted and the concentration reduced by air movement. That's why ventilation is very important. And that when we are exposed to direct sun, especially the early morning sun, we markedly reduce the population of the bacteria for TB. For SARS-CoV-2 is also airborne, especially with the Delta variant. But in addition, it is also a droplet. So we have to apply droplet precautions because with the droplets that come from touching the nose, the mouth, and the eyes, and then we touch common touch surfaces, then we pass on the virus. And that's why for COVID-19, we cannot share. Sharing of utensils is a no-no for COVID-19. But for TB, this is not a recommendation. We can still share utensils because that's not how TB is spread, only through airborne. Now, how do we do contact investigation? We do recommend X-ray screening for contacts of patients with TB that is drug susceptible. All 5 years and above should undergo X-ray screening, but pediatric age group less than 5 years old symptom screen only because X-ray is not really very sensitive. However, for drug-resistant TB contacts, all should be undergoing some contact investigation and should undergo X-ray screening, and if it's not available, to already do directly sputum testing using the gene expert. For diagnostic tests, we do not recommend other tests for contacts of drug susceptible TB because we have to confirm that the patient actually has a drug susceptible or a drug resistant strain before we start treatment for patients or the contacts of drug resistant TB patients. Now, I would just like to emphasize that X-ray is not a confirmatory test. So if you have an X-ray suggestive of TB, we have to proceed with the confirmatory sputum test, like your RT-PCR for COVID-19. So we have to proceed with your rapid PCR test, which we call the gene expert. And that's how we do the confirmatory test or to confirm the diagnosis of TB. There already are some support for specimen transport, and there are already algorithms to tell us on the safe handling of TB specimens during the COVID-19. So this is an example of your gene expert. So that's where we actually run the sputum specimen. And then this will give us the information whether we have tuberculosis. And second, if the tuberculosis that we have is a resistant kind of tuberculosis. This is the results that we obtained from the test. And perhaps for some patients, you might be asking, because you may have a negative gene expert, but based on the clinical evaluation of your doctor, it's still possible that you may have TB with a negative gene expert result because it gets to be correlated with other parameters, your X-ray and other laboratory findings. Now, this is also another example of your laboratory confirmatory test, your TB lump. Unfortunately, this does not confirm resistance. So gene expert is still the preferred sputum test for patients who have TB. And then there are already adapted changes for TB testing. We actually encourage the collection of specimen at home, and that there is already a system to relay the results to the doctor and to the patient if the laboratory actually has the TB information system in place. And I would like also to emphasize that COVID test is not required for TB testing because this is a common question that would potentially delay further TB testing. So a patient would either be bacteriologically confirmed if they would test positive on the sputum specimen, and clinically diagnosed if the doctor would decide to start treatment even with a negative sputum test. Okay, so in terms of treatment, I would just like to emphasize that tuberculosis is highly curable if it is detected early and if treatment is completed. Also, treatment is free. If you would like to avail of the TB treatment, the free TB treatment in health centers and selected private facilities with free TB services. But of course, it's a patient-centered care approach. If you want to still be under the care of your physician of choice, then you can request your doctor to prescribe TB medications for you if this is your option. But again, treatment is free in health centers and in selected health facilities. Now, in TB care, we have what we call patient-centered TB care, where we actually respect and value patient safety, comfort, and then emotional support and protection. We also offer social protection, especially for drug-resistant TB patients, where treatment is very long and very tedious, and side effects are not really few. And medications are really very expensive. So we offer free treatment, especially for drug-resistant TB patients. Now, the good news here during the COVID-19 pandemic, we used to ask patients to go to the health center every day. But during the COVID-19 pandemic, medications are given for a month supply. So patients need not go to the health center every month, every day, but just once a month. And there already are flexible clinic hours. In fact, there are already some new tools to monitor remotely the patient's treatment, daily intake remotely through digital means and through telephone follow-up. Now, these are the medications for TB. It's 6 months for your drug-susceptible TB and 12 months for TB that is involving the brain, the bones, and the joints. So it's kind of tedious, medyo matagal ang treatment, 12 months and 6 months. Therefore, the challenge of completion of treatment is really very high. Therefore, we encourage to have treatment partners, your family member, your spouse, or your children, or your parents as your treatment supporter, so that you'll be monitored in terms of your compliance to treatment. Unfortunately, for drug-resistant TB, it is longer, from a shorter 9 months to as long as 20 months, using at least 4 to 5 effective drugs. And these are not without side effects. Very difficult and very expensive. So for us to avoid drug resistance, better not interrupt our treatment early on. So in terms of prevention, it is something I would like to emphasize that we do have preventive treatment for TB. And this is something that we would like to highlight because not everybody knows that there's actually such a thing as TB preventive treatment. We have to understand that TB, once you're exposed, only 20% gets infected. So not everybody who gets exposed will get infected. And for those who are infected, not everybody will get the disease. You only have 5 to 10% lifetime risk. And that's the value of TB preventive treatment. When you are taking TB preventive treatment, you actually prevent the progression from infection to disease. And this is offered among patients who are contacts of index cases who are bacteriologically confirmed, who are tested positive on those smears. Together, similar with your COVID-19, there are vaccines for COVID-19, but there are no vaccines for TB. But there are no preventive treatment for COVID-19, but we have TB preventive treatment for TB. So that's the big difference. And I think this is something that we can avail of when we go visit the health center, or we can always ask our provider. So it's important that we have to rule out active TB first before we are given preventive TB treatment. So who are eligible for TB preventive treatment? Children who are less than 5 years old and are contacts of bacteriologically confirmed TB. Those who are more than 5 years old, household contact of bacteriologically confirmed TB with risk factors. So they have diabetes, or they have other risk factors that will make them a high risk to develop TB. Persons living with HIV, they also automatically would be eligible to TB preventive treatment. And for those who test positive on your IGRA, which will confirm TB infection, and those positive with your skin test with the normal X-ray, then you are also eligible to receive your TB preventive treatment. So this is what being offered in the health center. This is free, 6 months of your isoniazid every day. But we already have newer TB preventive treatment, as short as 3 months for your isoniazid and rifampicin. And this is preferred for children. Or you have 4 months of your rifampicin daily for adults. And the shortest is actually your 3-HP. But unfortunately, it's not yet locally available. But this is the shortest. It's just once a week, and it's given for 3 months. So I think that's the what I would like to emphasize about TB prevention. And for those who would like to ask about COVID-19 vaccination, if you have TB, definitely there is no contraindication. Go ahead and get your jab, and this can be given anytime. TB patients are considered A3 priority group for the COVID-19 vaccination. So I think this is my last slide. I'm happy to answer any questions that you have. Back to you, Pat.
Thank you so much, Dr. Lalaine. That was actually very extensive. We really appreciate it. Our Maxicare members learned so much about TB today, thanks to you. Now, Doctora, to enhance our knowledge and support the lecture shared by Dr. Lalaine here is a series of animated videos we'd like to share with all of you on how TB is transmitted, how to battle TB and COVID-19, how TB is treated, and how you can be a treatment partner should you have anyone in the household with TB. Please watch this.
Gaano ka kalakas? Sinlakas ba ng kargador, pasan-pasanay sako-sako? O ni Sergeant Cardo, kalaban ng mga pasaway at sanggano? Gaano ka kaya naman kalakas laban sa sakit na dala ng mga umaaligid na mikrobyo? Puntirya ang mga baga mo. Mikrobyong tulad ng COVID-19 o ng Mycobacterium tuberculosis mula sa isang taong may TB. Kapag nalanghap mo ang hanging may TB bacteria, susubukan nito ang iyong lakas. Sa umpisa ay lalabanan ng iyong resistensya ang TB bacteria. Matutulog muna ang mga ito sa iyong baga. Nag-aabang, naghihintay hanggang dumating ang oras na humina ang iyong resistensya. Magigising na sila at maghahasik ng sakit. Ikaw ay uubuhin o lalagnatin ng di maipaliwanag o mangangayayat ng di naman nagpapapayat o sa gabi na may pinagpapawisan. Kung tuloy-tuloy ang isa sa mga sintomas na ito at umabot na ng 2 linggo, magpa-check up agad dahil baka umaatake na ang dating natutulog na mga mikrobyo. May TB naman na walang ganitong mga sintomas at umaatake sa ibang bahagi tulad ng iyong leeg, buto, tiyan o utak. Ang TB ay nagagamot. Mas maagang malaman kung TB nga ang kalaban, mas maayos ang magiging gamutan at mas madali ang pagbalik ng lakas ng katawan. Para TB-free, pa-check up agad. Yan ang daan sa bago mong lakas. Gaano ka katatag? Sintatag ng kawayan sa hampas ng hanging nakikisayaw? Sintatag ng bantay ni Rizal, nakatayo ng buong araw? Gaano naman kaya katatag ang iyong mga baga? Kahit ilang beses ang akyat baba o humabol sa humaharurot na bus. Ang iyong mga baga ang isa sa mga pangunahing bahagi ng iyong katawan na maagang tumatanda at unang humihina. Kaya dapat matindi ang iyong pag-alaga sa kanila. Kapag mahina ang iyong mga baga, madali kang tatablan ng mga sakit na dala ng mikrobyong umaaligid tulad ng COVID-19 at Mycobacterium tuberculosis. Ang pagbahing, hatching at pag-ubo ay natural na depensa ng iyong katawan para alisin ang mga mikrobyo sa iyong ilong, lalamunan at mga baga. Ang iyong ubot hatching, lagi mong takpan. Magsuot ng face mask kapag nasa pampublikong lugar at lansangan. Magtakda ng 1 metrong distansya mula sa iba para walang hawaan. At kapag nakaramdam ng mga sintomas ng ubo, lagnat o hirap sa paghinga, pa-check up na agad. At baka COVID-19 o TB na yan. Pagdating sa mga sintomas na ito, hindi kailangan ng patatagan o patagalan. Para TB-free, pa-check up agad. Yan ang style ng taong matatag. Gaano ka katibay? Sintibay ng haliging di payayanig sa magnitude 6? Sintibay ng boksingerong umaabot ng round 12? Gaano ka naman kaya katibay para matapos ang gamutan laban sa tuberculosis? Depende sa uri ng Mycobacterium tuberculosis na iyong nasagap, maaaring tumagal ang gamutan ng 6 na buwan hanggang 1 taon para sa drug-susceptible TB, ang TB na mapagagaling ng pangunahing gamot o first-line drugs. Tumatagal naman ng 9 na buwan hanggang 2 taon ang gamutan laban sa drug-resistant TB, ang mas matinding uri ng TB. Ang TB ay nagagamot, pero dapat araw-araw mong iniinom ang iyong mga gamot sa takdang oras o ayon sa payo ng iyong doktor. Kung may maramdaman kang side effects tulad ng pagkahilo, pagsusuka o pangangati, ipaalam sa iyong treatment partner, nurse o doktor. Nalulunasan ng mga side effects na ito kaya huwag kang susuko, huwag kang bibitaw. Mapatutunayan mo sa iyong sarili at sa mga mahal mo sa buhay kung gaano ka nga katibay. Para TB-free, huwag magminti sa gamutan. Tibayan ang iyong dibdib. Gaano ka katutok? Sintutok ni Bisor sa assembly line? Sintutok ni Biyenan kapag nagluluto ka ng sinigang? Gaano ka naman kaya katotok kung ikaw ang treatment partner laban sa tuberculosis ni Mrs. o ni Father o ni Brother o Sister? Matindi ang bagsik ng bakterya na sinhi ng TB, kaya ang gamutan laban dito ay ganoon din katindi. Ang TB ay nagagamot, araw-araw at inaabot ng 6 na buwan hanggang 2 taon ng gamutan, depende sa uri ng TB na ginagamot. Kaya dapat matutok ka bilang treatment partner ni Mrs. o ni Father o ni Brother o Sister. Hindi siya dapat magmintis sa gamutan. Tumawag sa inyong nurse o doktor para sa kanyang supply ng libreng gamot sa loob ng 1 buwan. Tutukan din kung may maramdaman siyang side effects. Nalulunasan ang mga side effects na ito kaya bigyan siya ng lakas ng loob at tibay ng dibdib. Para siya ay TB-free, huwag magmintis sa gamutan. Bilang treatment partner, maging matutok na may kasamang tender loving care.
Those videos were very, very informative, but I'm sure our Maxicare members continue to want more information about this very important topic. So allow me now to introduce an expert who will facilitate the Q&A, because I noticed that we do have a lot of questions here. So we thank you in advance for all those questions. Our facilitator is a diplomat and a fellow of the Philippine College of Physicians and the Philippine College of Chest Physicians. He heads the section of pulmonology of the Department of Internal Medicine and is the chairman of the Committee on Pharmacy and Therapeutics in the De Los Santos Medical Center. We're so happy to have Dr. Freddy Paleo with us today. Hi, Dr. Freddy.
Yes, hi Patricia.
Hi there. Thank you so
Okay,
much for joining us, Dr.
better. Yeah. Yes, good afternoon. Thank you everyone better. So thank you everyone for joining us this afternoon. Actually, it's already nearing 6 p.m. So a good evening to everyone. Thank you very much for that kind introduction as well, Patricia. Before we proceed further to the open forum, I just would like to give a synthesis of what Dr. Nalin has discussed to all. She has comprehensively and extensively discussed TB to all of us. So reinforcing that the Philippines is among the 10 countries in the WHO list for high burden countries for TB. In fact, she also mentioned in 2019 it has been recorded that TB incidence in the Philippines is about 554 out of the 100,000 population. Also, TB is among the top 10 causes of death in our country. And she mentioned that there are actually about 3 deaths per hour, summarizing that in a day, we have 74 Filipinos die of TB daily. For this reason, we need to continue educating and disseminating facts about TB for its control amidst COVID-19. So chronic cough of at least 2 weeks is the cardinal symptom that one should consider TB already. The other manifestations Dr. Laling mentioned, apart from 2 weeks of cough, are fever, weight loss, or night sweats. We already label one as presumptive TB if patients have any of this. Now, transmissibility of TB is airborne. She mentioned that COVID-19 may be both airborne, particularly for the Delta virus, and via droplet contact. So the reasons for patients not consulting, she mentioned 3. People deem symptoms that are significant. They consider the cost actually of the consultation and treatment. And mostly of our people cannot really find time to seek consult. And the prime factor is the stigma that TB brings to our society. Now, screening by chest X-ray with findings suggestive of TB increase the likelihood of TB. And due to the prevalence of TB in the country, chest X-ray is of value. Though mentioned that it is not confirmatory, we need to do gene expert to confirm the presence of TB bacilli. Treatment is free in our health centers. Patients may visit our health centers once monthly during this time of pandemic. And we already encourage digital follow-ups or by phone calls. And mentioned the prioritization of treatment to prevent drug resistance. As regards preventive has been discussed that there are certain substances eligible for TB preventive, and we would like to remind everyone that no vaccine is available for tuberculosis, but with TB preventive treatment mentioned, 6 months of isoniazid, we have to as low as 3 months containing medications like isoniazid and rifampicin. I just would like to reiterate that COVID test is not required for TB testing. So during this time of pandemic, it is not only COVID that is important. Reiterating that both COVID and TB are respiratory diseases with similar symptoms of cough, fever, shortness of breath. Now, presence of history of TB increases risk of SARS-CoV-2 infection and higher risk of severe COVID-19 disease. That is why TB patients should be vaccinated. Now, similar comorbidities like malnutrition, as mentioned, diabetes, smoking, COPD, and including HIV increases risk for both diseases. And similar health protocols like use of face masks, strict hand washing, and even physical distancing are required for both. Now, both diseases, likewise, require early detection and treatment to improve outcomes and reduce transmission. Contact tracing would be very important for both in order to control the disease. Hence, we need to deal TB really no matter what during this time of pandemic. So I think that's basically what Dr. Lalaine discussed about TB during this time of pandemic. And at this point, I would like to call back Dr. Lalaine for our question and answer for our open forum. Lalaine?
Yeah.
Yeah,
Good
good afternoon,
afternoon.
Lalaine.
Good evening. Good evening.
Good evening. Yeah, it's already 6 p.m. So, Lalaine, we have one question here. Are there new medicines or treatment for drug-resistant TB patients?
Actually, what's very good with the National TB program, they already have introduced newer anti-TB drugs for resistant TB. So they're already doing away with the injection. So if you notice, they are now shifting towards all oral regimen because we noted that patients are afraid of injections. This should be taken for a long period of time, and they have to go to the facility to be injected. But with the current regimens that we are giving now for drug-resistant TB, it's all oral and it's already shortened. So these are what is being given for free in the health centers for drug-resistant TB.
Okay, thank you, Lalaine. One question was about the impact of COVID vaccine, but you have already answered it, that we need to be vaccinated. So we'll skip that. So how can you get infected or reinfected after treatment for TB? So there's this patient who have been treated for TB. So is it true that when your immune system is low, you can get reinfected, or do you need to be exposed again to the TB bacteria for you to be reinfected?
Yeah, so reinfection is really very high. In fact, previous TB treatment is a risk factor to develop TB. So there's no such thing as immune. You develop immunity to TB and you will never get it again. So you can always have it. So that's the reason why we proactively do surveillance among patients who were treated for TB by your annual X-ray to see whether you will develop TB again. And then, of course, when you eat healthy, you sleep healthy, and you don't have any vices, then you're okay. You may not develop TB again. But of course, being exposed to somebody who is untreated of TB may be the one who would bring the bacilli to you again. So I think we just have to be wary of all these things. Back to you, Dr. Freddy.
Okay, thank you, Lalaine. One attendee had extra pulmonary TB. Her question, the question is, how does he or she ensure that it doesn't come back in any forms, whether pulmonary or extrapulmonary? Do we have tests or procedures that can be done to ensure that this problem with TB is already healed?
Yeah, so actually that's the value of contact investigation. So if a patient has TB, all the rest of the household should be investigated to also work up for TB. Because if you completed treatment and you have a member in the household who has active TB, then the cycle goes again. You again have a source case. So the contact investigation would allow us to treat all those who also have TB in the household. Now, in terms of prevention, I think having your annual X-ray even after treatment would be helpful so that we'll be able to know whether we see some progression or increase in the infiltrates that we have on X-ray. But I would like to emphasize that not everything on X-ray is only TB. So we have to be worried that there are other conditions that may mimic TB, but not necessarily TB.
like malignancies, for instance. No? Yes. Okay. So another question: would taking multivitamins alleviate the chance of getting TB?
Well, multivitamins are not miracle drugs. So again, prevention. I think what would be I would be recommending is the TB preventive treatment, especially if you are eligible for TPT. That's a better alternative than your multivitamins. But of course, your supplements may always give us additional immune booster, but not necessarily prevent TB from happening.
All right. So there's another question here. The recommendation for patients with pulmonary fibrosis by chest radiograph and those with history of completed treatment for TB. Recommendations for them.
Yeah, so again, having the fibrosis on your X-ray is really very tricky. Among patients who
Okay.
already underwent treatment and then you establish stability, you have evidence that the fibrosis is very much stable from way before and the current X-ray, then there's really nothing to be worried about. But what we are after are those untreated with X-ray with untreated TB and they are presenting with fibrosis. This may in fact be the reason for you to undergo some testing so that you'll be able to know whether the fibrotic lesion there is actually an active lesion or not. And the only way to confirm that is to undergo bacteriologic testing. Again, X-ray would help us triage what is the next step, but it will not confirm TB.
Okay. Another question. Uh, may connection daw ba ang pananakit ng likod sa TB? May mga instances ba na ng likod may be associated with TB?
Well, back pains is one of the non-specific symptoms of TB, but it is not exclusive for TB because back pains can also be present in pneumonia, can be present in musculoskeletal strain, and other conditions that are affecting the lungs. So back pain may be part of TB, but not confirmatory or specific for TB. So it's not included in the cardinal signs and symptoms for TB.
Yeah. So there, Elaine, there is where this is actually a personal experience. So this attendee who sent this question has a concern. So I'll read it verbatim. So sabi niya dito, I've been diagnosed with
Hi, Dr. Elaine. Thanks so much for answering all those questions. They've actually been really
sorry, sorry, I
so.
got lost.
Dr. Freddie,
I'm
go ahead,
back.
Dr.
Do you
Freddie.
hear me?
Yes, you can hear you. Go ahead, Dr. Freddie.
Hello? Okay. Okay, I'll just read back the concern of one of our attendees. So this attendee had been diagnosed last week, and she was only given two two types of drug, and she had an allergy to rifampicin. After medication, Um, the pulmonologist cleared her at no fibrosis. No? Nawala yung X-ray findings niya. And then after 2 to 3 months, this patient suffered cough again and colds. So she had a consultation again. Uh, a repeat chest X-ray was done, and a spot or probably a fibrosis was eventually noticed. Anyway, this patient completed the medications for TB, and she was just prescribed mucolytics, anti-allergies. So she's a bit. I think the gist of her concern here is initially nawala yung X-ray finding. Nung nagkaroon siya ng symptoms, nagkaroon ulit siya ng spot, which actually happens because of inter-reader variability naman, diba?
Yeah.
Yun yung concern.
Yeah, so I think it's very important for us to choose where to have our x-rays done because there are many artifacts to our x-rays. And then sometimes if we go to facilities with poor quality x-rays, nag-iiba yung film and it makes comparison review difficult. So I think it's very important to keep our x-ray films because it's very helpful for the doctor to decide whether we have progression or regression on x-ray review. At the same time, it will also help us confirm whether patients would benefit from testing again their specimen for confirmatory testing. But like I said, patients who have fibrosis from previous treatment may already present with the scar tissue. And if it is stable over time, then there's really no need for treatment. If patients come in because of symptoms like cough, we also have to entertain other causes of cough, not only TB, but TB should be part of the differentials. Back to you, Dr. Freddy.
Yeah, so especially ask pulmonologists to review and eventually say to you, our patients, that you don't have to worry. This is already fibrosis. So there's actually a concern about booster shot or vaccine for TB, but the lecture already mentioned about no vaccines for TB, but we have TB preventive treatment. No? So I think we have answered that earlier. Ito, yung mga asymptomatic TB, can you have TB without cough? So asymptomatic pero may active TB disease.
Yeah, actually if I answer that, medyo relative kasi ang cough when you ask Filipinos. So if you ask them, may ubo ka ba? They will say no. But if you look at the X-ray, there are ill filtrates and you notice them coughing, especially if smokers, they deny that they have a cough. So again, we have to interpret our patients' information, whether they say that they have cough or they deny cough. But we have to correlate their manifestation or clinical presentation with their X-ray. So it's also possible though that you may have TB without cough, but you should always have the X-ray finding on your, you should always have a finding on your X-ray.
So I think wait, last question. Okay, thank you. So there's this attendee who had COVID confirmed last May. The patient was diagnosed to be COVID positive last May. Um, she complete she completed or he completed the quarantine and had a chest CT scan done, and it stated that the patient had fibrosis. So the question is, um, does this finding secondary to a TB infection or COVID infection? It was not mentioned where the fibrosis is located.
Yeah. That's actually something that we have to understand because COVID may cause fibrosis. This is what we call the post-COVID fibrosis. And it might be similar to TB, but I think what we can only share with the audience is that there are certain patterns that we get from TB. So it usually occupies the upper area of the lungs. so the upper part of the lungs. But for the fibrosis due to COVID, it is elsewhere. It can be located anywhere. But for us to determine whether the fibrosis that you are looking at in the CT scan may be due to TB or not, we can always proceed to a bacteriologic confirmatory test like your gene expert. So it's like RT-PCR. For TB, it is the gene expert.
Okay. May na-skip daw tayo. I'm not sure if this is the one. Okay. I think this is the one that was skipped. Sorry. So for a 5-year-old patient diagnosed of TB, was given medications but did not finish the medication, what will happen? So for those not completing
Yeah.
treatment, what will happen to these patients? Not
So
necessarily 5 years old or any age for
yeah.
that matter.
So I would just like to emphasize that TB is curable, but only if it is completed. And the emergence of resistance is highest if we interrupt treatment. So we discourage discontinuation of treatment, especially if they feel better. So that's the most common thing among patients. If they feel better, they stop medications, and they do not complete what is prescribed. So if we interrupt, there's a chance that we develop drug resistance TB, and that's the why it is important to have the sputum test done, because the sputum test will identify whether we already have developed the drug resistant TB or not yet. So again, TB is curable, but we have to complete treatment.
Okay. Actually, the questions we've been discussing are the questions that were screened. So we would like to apologize for the others whose questions were not directed or answered. Perhaps later on, Dr. Laling will be providing us with these answers along with the staff of Maxicare for everyone's satisfaction. No? But however, we are running out of time already. So I would like to call in Patricia.
Yes, thank you so much, Dr. Freddie and Dr. Lalaine. And we really appreciate you. Actually, before you go, maybe a final message from Dr. Freddie, perhaps? Okay, with the technical difficulty we're having, Dr. Lalaine, could you kindly share with us your final message, please?
Yeah, so TB is curable, and it can only get cured if we complete treatment. And let's not be afraid if we have TB, because treatment is available. Let's destigmatize TB. So let's offer them support if they have TB. And we have to actually, I would really recommend that if we care for the family, then we do contact investigation and evaluate whether the rest of the household members also have TB. So I think that's a lesson that we learned from COVID-19, the value of contact tracing. And for TB, it's just that it would require longer treatment, but patience is virtue. As long as we complete treatment, then we can be TB free. So I would like to enjoin everybody to help the Philippines achieve its goal to be TB free.
You know, Doctora, it's just amazing that our attendees here are really so engaged in this discussion. And I just wanted to share one more question, if you may. The question is, if intermittent cough for more than 2 weeks can be a symptom, even if one does not have fever, does not feel weak, or does not perspire at night, or exhibit any other symptoms associated with TB? I guess also that's a concern for many because they just want to understand what they're supposed to be feeling.
Yeah, so that would qualify with those patients without the cardinal symptoms, and I would suggest them for them to undergo chest X-ray, and that's it. If the chest X-ray is clear, then you don't have to be worried. The intermittent cough may be due to another symptom, but if you have already findings that are suggestive of TB, then you are already a presumptive TB, and therefore you have to need to start collecting your sputum to confirm TB.
Wow. It's just a lot of questions, and I wish we had time. But thank you so much, Dr. Lalaine. Now, before you go, Dr. Freddie, may I also ask for your final message?
Okay, COVID-19 has greatly changed our way of life, and we cannot hold large gatherings as we meet by virtual means while within the comforts of our homes. So during this time of pandemic, a lot of other diseases have been set aside, short of saying, not given too much importance, like tuberculosis, because all forms of resources have been directed to COVID since last year, as it is a priority worldwide. However, this cannot be. That is why we have discussed TB today to reiterate the importance of this disease, that we need to fight TB against or amidst this pandemic. So good afternoon, everyone, and thank you.
Thank you so much, both of you, Dr. Mortera and Dr. Paleo. We really appreciate your time and your expertise on this very important topic. Now, that was such a valuable experience for all of our Maxicare members today. To our attendees, thank you so much for participating in the Q&A and for being so engaged throughout the event. To our Maxicare members, we'd now like to ask you to please share your time and your feedback through a feedback form that's going to be shared on the link and also the QR code that we're flashing on the screens right now. Of course, we would really appreciate your feedback. Maybe perhaps more time for Q&A or whatever it is that you're sharing with us. But we do appreciate the time of our two doctors today. And as you can see, people just really need more information about this. So I'm happy that we're able to actually raise awareness on tuberculosis through this very important event. Now it's time to announce the winners of our raffle draw. The winners were randomly selected earlier by our staff. And as a reminder, we have either a laptop bag, a foldable umbrella, or a mini clutch bag that we're giving away. And the winners, ladies and gentlemen, are... Dun, 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 dun. Ino de la Cruz of Microsourcing Group Philippines. Congratulations, Ino. You win the leather laptop bag. And our foldable umbrella goes to Cara Bustamante of Equicom, and Christine Ivy Gamut of Marriott Manila gets the mini clutch bag. Congratulations to all of you. Our Maxicare team will be in touch with you regarding the claiming of your prizes. Now, for everybody, before you go, we have two real quick poll questions. And the first one is always an affirmative question, right? You don't have an option but to have a positive answer to it. Do you want to live your best life? From all the Maxicare events that we've had, um, it's really leading you to live your best life because it shares with you information. It gives you wonderful experiences and knowledge and know-how. So yes, of course, or oo naman, are the two answers that we want to see from you. And of course, everyone wants to live their best life, which is why they came to this event, which is why you're here at this event. And you continue to go to our other Wellness Fridays event brought to you by Maxicare. Now, in relation to that, please tell us which topics or activities you'd like to see in future Wellness Fridays events, and you can choose more than one, please. Managing mental health, that's something that people are always looking forward to. How COVID-19 affects children. What about blood disorder types and treatments? Breast cancer awareness, and perhaps you'd like to know more about how to achieve a healthy weight. That's interesting. So it's not just weight loss, losing weight, but a healthy weight. It's not always. Well, anyway, that's just me, right? I also struggle with that, but that's something I'd like to attend. And you guys have the same thinking as me. You'd also like to achieve a healthy weight, not necessarily skinny or anything like that. Healthy. That's great. And a lot of us also want to know how we can manage mental health better. So they are listening to you and will share with you more information on future events. Now, if you enjoyed this experience, please do share it on your social media and use the hashtags Live Your Best Life and hashtag Maxicare Wellness Fridays. And you can even tag them on Facebook at Maxicare Healthcare Corp, on IG at Maxicare Healthcare, and they have their Maxicare Health and Wellness IG also, Maxicare Health and Wellness. When you share about your wonderful takeaways about this and other wellness events, please don't forget to also subscribe to their YouTube channel, and you can find them on YouTube at Maxicare Healthcare Corporation. To learn more about their products, please do visit www.shop.maxicare.com.ph or shoot them a message on FB Messenger. If you have questions about the Wellness Fridays, you may send an email to maxicarewebinar@maxicare.com.ph. I hope to see you guys on the next Maxicare Wellness Fridays event, which will be on September 10 at 5 p.m. Now, we will talk about a topic on mental health. See, they listen and they respond right away, but it is going to be a great topic on mental health, and we'll share more information later on. But the QR code for the registration is already available this side on your screens right now, and it's being flashed. So make sure you all register early. That ends our event for this evening. Thank you so much for being with us. We appreciate your time, and we hope that you were able to take away meaningful information and enjoyed being with us here. Thanks again. Have a great evening. We know that with MaxiCare, you can live your best life.